Hello, this is Jose Marnotes, and I would like to thank you for attending the presentation for the Heuristic Evaluation of HealthCare.gov. This presentation was prepared for the U.S. Centers for Medicare and Medicaid Services by Alexander Reyna, Jose Marnotes, George Ramirez, and Michael Gorga on behalf of Florida International University. Let's get started by talking about what is HealthCare.gov. HealthCare.gov is a healthcare exchange launched in 2013 by the U.S. government to meet provisions under the Patient Protection and Affordable Care Act, better known as Obamacare. You could think of an insurance exchange as a sort of Amazon marketplace where insurance companies provide insurance packages and the website facilitates the transactions. Who uses healthcare.gov? Much like Amazon, healthcare.gov is used by millions of US citizens and residents. Over 10 million visits were recorded on the website in November alone, and it is estimated that over 80 million people, that's 1 in 4 Americans, can benefit from the coverage sold through the healthcare.gov site in 2019. Why evaluate healthcare.gov? What benefits can be had from such an endeavor at this point in time? HealthCare.gov had serious trouble when it launched in 2013, with thousands of visitors unable to complete their transactions. It was reported that only 6 people were able to register on the site's first day. Open enrollment for 2019 runs from November 1st to December 15th, and this sign-up period is the peak season for this website. That means that most of the traffic that this site will receive this year will be concentrated into this month-and-a-half period. Considering the number of users using the site, its prior issues, and the urgency of the open enrollment period, the heuristic evaluation was undertaken to find whether issues have persisted from the site's launch and to help restore user confidence. Our executive summary outlines the high-level steps taken to provide the heuristic evaluation. First, we conducted preliminary research of leading healthcare websites to identify best practices within this industry. The websites reviewed included government sites such as Medicare.gov, large university medical centers such as the Indiana University School of Medicine, private healthcare systems such as the Mayo Clinic Health System, and private insurance providers such as Centura Health. The review of healthcare.gov was performed using a subset of Jacob Nielsen's 10 general heuristic principles. We'll discuss more on how these specific heuristics were evaluated later on. Observations and findings were analyzed and discussed by the team. Brainstorming sessions were conducted to find possible solutions to areas of opportunity found within the website, and recommendations were provided where applicable. A standard evaluation form was used to allow 4 evaluators to separately evaluate the site while observing the same guidelines for each heuristic area. The form pictured below contains the 7 heuristic areas along with high-level summary to aid the evaluator calibrate their search and feedback along the left border of the form. Each evaluator would then score from 1 to 5, with 1 being low and 5 being high for each heuristic category in the center area of the form. An area is provided to the right for general feedback. The overall score for the site would be determined based on an average of the individual heuristic scores. You'll note that the areas are weighted to concentrate scores in the middle of the range, similar to a bell curve, with only 0.5 range for extreme values of very poor and very good. Now, I would like to introduce my co-evaluator, Michael Gorga, to begin the review of the specific heuristic areas.
Thank you, Jose. As it was briefly mentioned, the 7 heuristics that our team used for the evaluation of this website were derived from Jacob Nielsen's 10 general heuristic principles. First, I would like to discuss the flexibility and efficiency of use of HealthCare.gov. Team 5 was looking at the different usability options for users to update their healthcare plan or enroll in a new one for the 2020 year. We have found that the website is extremely versatile with providing information to its users about their healthcare plans by having multiple communication options. Overall, the team concluded that the flexibility and efficiency of use of the website was good for its users. For users accessing HealthCare.gov, we found that the website provided full navigation and support in both English and Spanish, while also providing similar information in 13 other languages that could be viewed in a PDF format. At the bottom of every web page of the website was a phone number displayed in the resources section for users to call if they had any questions about enrollment or navigating HealthCare.gov. Another option provided by the website for its users was the ability to find a local consultant to help people create or modify information based on the user's city and state or by their zip code. One recommendation that we could offer to increase the flexibility and efficiency of use for users on healthcare.gov would be to have visual representations of the information that is displayed. Most of the information was text with little support from visual aids like videos. Medicare.gov was another website that Team 5 used as a reference because of its similar nature, and on its homepage is a video that notifies users of the open enrollment date of Medicare services. This is one way that healthcare.gov could provide its information to its users. Another type of visual aid that is effective for users in a web-based format are infographics. Recognition rather than recall was the heuristic that Team 5's evaluation determined where the healthcare.gov website could use the most improvement. We were looking for different user options to help people navigate, recognize concepts, and recognize items in multiple ways. The team has acknowledged that the resources used were less than adequate considering how complex healthcare can be. There was little to no instances of content for recognition throughout the website. The resources that were created to help users understand different aspects of the website and the enrollment process were all external links with information via text or was information that could be found in the glossary section of the website, which has many internal web pages of textual information. The information found in these resources pertained to the navigation of the website, defined various healthcare terminology, and answered the most frequently asked questions by the users of healthcare.gov. In order to help users understand information through recognition rather than recalling it, this website should consider limiting the fields of information for its users. All the resources and terms that help users are not applicable to everyone. If healthcare.gov could limit the amount of information it is to display to its users, it would be more effective. Another way to help users with usability of information on healthcare.gov would be to implement virtual AI assistants. It was important for us to consider how helpful voice assistants are, such as with Siri or Alexa. Visual assistants like Clippy from earlier versions of Microsoft Windows would also be helpful to users navigating the interface and information of the website. The last heuristic I would like to discuss with everyone today is aesthetics and minimalist design. A website can look visually pleasing but not very useful for its users. So for this aspect of the evaluation, we were looking at the continuity of the web page design that was essential and effective for its users. It was observed by all members of Team 5 that the website maintained a good and consistent design that was easy and effective. Healthcare.gov maintains a simple design that does not distract from the user, and it is used in nearly every aspect of the website. Each page sticks to the same color scheme of using blue, gray, and white, while also including green buttons that show areas of user actions and user input. For a government website that assists in enrolling users in different healthcare plans, there is little to the design or the aesthetics that could be changed to better the usability of the website for its users. One glaring issue that was not consistent with the minimalist design of healthcare.gov was the See Topics drop-down menu on the main navigation bar of the website. This is not consistent with the other buttons that bring you to another page for information. If this section had its own dedicated web page, it would free up a large portion of the screen and make the website more usable to users and a lot more efficient. Now I would like to introduce Alexandra Reyna, who will continue to expand upon some of the heuristics that we use in Team 5's evaluation of HealthCare.gov website.
Thank you, Michael. As he mentioned earlier, some other heuristics that Team 5 also evaluated on HealthCare.gov was user control and freedom and help in documentation. First, I will be discussing HealthCare.gov's user control and freedom. While evaluating HealthCare.gov, Team 5 was looking for how easy was it for its users to navigate freely throughout the website. Overall, it was decided that HealthCare.gov scored a 4.25 for user control and freedom. We found that HealthCare.gov does an excellent job allowing for its users to freely navigate. Once you visit the website, it immediately allows you to start choosing where you would like to navigate. There are multiple buttons to choose from in order for you to best find what you are looking for. On top of that, the top border provides a constant navigation pane, including a HealthCare.gov link on the top left, allowing users to always return to the homepage if they please. There is also a search function available to allow users to immediately search what they are looking for, if they choose not to navigate through the buttons. Finally, the website still provides a footer found constantly throughout the bottom of the website, with additional links that are less commonly used but still important. HealthCare.gov demonstrates excellent use of user control and freedom, and there are really no recommendations needed for this area. Second, I will be discussing HealthCare.gov's help and documentation. While evaluating HealthCare.gov, Team 5 was looking for how much assistance HealthCare.gov provides for its users in the event that they need it. Overall, it was decided that HealthCare.gov scored a 3.75 for help and documentation. We found that although HealthCare.gov does provide many solutions for users to find documents that will help them, there is no proactive system. By proactive system, Team 5 means that there is no function provided like a chat now option, where users can connect to a chatbot or even a live representative that can further assist its users if documents are not enough. Many modern websites use this function today, and a chat now option usually pops up after a set duration of time if activity is not occurring. This will allow the user to become re-engaged with the website and allow them to continue and finish their search. Implementing the system into HealthCare.gov can help many frustrated users that are not finding the answers they need. Aside from this, HealthCare.gov still does a great job providing other help and documentation resources such as the Get Answers and See Topics links. They also provide a footer page at the bottom of the website with more information such as the glossary, contact us, accessibility information, privacy policy and privacy settings, and using this site. The website also provides a pre-footer navigation area on top-level pages that provides a resources area with links to information about the Affordable Care Act and a number that you can contact for further questions. Now, I would like to introduce George Ramirez to finish discussing the last heuristics used to evaluate HealthCare.gov.
Thank you, Alexandria. To continue, match between system and the real world is the principle where the system should speak the language familiar to users. Match between system and the real world scored well in Group 5's evaluation. There were opportunities for the HealthCare.gov website to clarify healthcare words into commonly understood terms. In Group 5's evaluations, Healthcare does a great job relating healthcare terms of users that are looking to purchase insurance. In Group 5's evaluations, there is a glossary of insurance terms with over 250 entries. There is also an option to mouse over certain terms that show pop-ups with definitions and descriptions of terms. These are helpful to users because it translates healthcare diction into the language that is familiar to the users. The next and final heuristic evaluation principle is consistency and standards. This is where the consistency of the website's interface, diction, color schemes, and principles are evaluated. Group 5 saw that the website is consistent throughout the site in all aspects. Group 5 found that the color scheme stayed the same, there were source codes to ensure consistency, and the banners and pictures were constant. Finally, in summary to recap, excluding recognition rather than recall, the heuristic evaluation performed well in Group 5's research of HealthCare.gov. The site was created to let users purchase insurance in a fast and easy way and it succeeded, all while exceeding in website testing evaluations. We appreciate you all for listening and attending Group 5's Heuristic Evaluation presentation on HealthCare.gov. Thank you.